Good afternoon, friends. Psalm 46 says, God is our refuge and strength, a very present help in trouble. Therefore we will not fear. Though the earth should change, though the mountains shake in the heart of the sea, though its waters roar and foam, though the mountains tremble with its tumult, Selah, which means pause, take a breath. There's a river whose streams make glad the city of God, the holy habitation of the Most High. God is in the midst of the city. It shall not be moved. God will help it when the morning dawns. The nations are in uproar, the kingdoms totter. God utters God's voice, the earth melts. The Lord of hosts is with us. The God of Jacob is our refuge. Selah. Take a breath. Really, right now, take a breath. I am Don Remick, the Bridge Conference Minister for Innovation and Governance. First, on behalf of myself and my Bridge Conference Minister colleagues, Kent Salati, Bridge for Finance and Justice, and Marilyn Kendricks, Bridge for Discipleship and Outdoor Ministries, I want to thank you all for being on this video call. We are recording this so you can follow it later. This is a challenging time for our churches and our community. And preparation, information, and mutual support are our greatest tools in these times. And you are the people of God who know that God is in the midst of chaos with compassion and peace. And you are the people who bring God's compassion and peace into the midst of the chaos in the world around you. We live the love and justice of Jesus. Second, I want to thank you. Your conference staff has been in overdrive, listening and learning and responding and adapting to this ever-changing situation. Other UCC conferences across the country are either just beginning to encounter the pandemic or have been deeply immersed in it, and we have been sharing insights with each other. We continue to develop extensive resources for our churches and are learning from the adaptations you bring. On the call today is Debbie Ringen, our Southern New England Minister for Health and Wellness. She'll be sharing information with you shortly, but I want to thank you. It's your gifts, your resources, and your support to your conference that have enabled our staff to gather and provide resources and support to you, to your churches, and to your communities. We have an exceptional website of resources, information, and advice at sneucc.org/coronavirus. We'll be offering these videos again from time to time, and again, they will be recorded. So we want to thank you for making this video and these resources possible. Throughout this time, this video, if you have questions, please feel free to add those in the comments section or the chat box. We'll be following along with those towards the end. You might want to save some of them. You might actually hear answers as we continue on in our conversation. We will do our best to answer the questions you offer. If we can't get to them all, that you can be looking in future resourcing for responses to those questions. I would like to turn this over right now to Debbie Ringen so she can share with you a bit of the insights about the current moment.
Hi, everyone, and thank you, John. I'd like to start by telling you just a little bit of the World Health Organization Director General's opening remarks from yesterday when they declared that this is a pandemic now. The four key areas of importance for us to really pay attention to are to first prepare and be ready. And that includes educating ourselves about what's going on around us and keeping in touch with our public health department statements and the CDC and the World Health Organization. Secondly, as a country, we need to focus on detection, protection, and treatment of those that do become ill. And thirdly, reduce transmission, and that's where we all play a really big part. And the fourth key is learning how to innovate and learn more about how we can continue to stay connected with each other and keep each other safe. It's not just about whether or not we might get the coronavirus or COVID-19, but whether we would have even a mild case that we might not even recognize, and we might transmit it to an elder, someone over 60, someone with chronic conditions of heart disease, kidney disease, diabetes, or undergoing chemotherapy, different things that reduce immune function. So we have to take care of ourselves, and then we have to think about protecting others as well. The best way we can do that is to avoid contact with people who might be sick. So if anyone is feeling ill, particularly with a fever, a cough, and shortness of breath, they should stay home, call the doctor. The doctor will then advise you whether you should monitor yourself at home or go to an emergency room. They may contact your local public health department to see about getting you tested if need be. But calling your doctor's office is the first step. We need to wash our hands frequently, 20 seconds, soap and water, hand sanitizer if we have it, really scrub, and then not touch our face and hands. I was with elementary school age children this morning teaching hand washing. And one of the big things along with washing your hands is not touching the T-zone. And that T-zone is, your nose to your mouth and then your eyes. And so if you can remember that and keep your hands away from your face, you can prevent any germs that have gotten on your hands from getting into your body. Covering your cough or sneeze with your elbow. One of the students said they were told put their hand on their shoulder. So then your elbow's right there. If you need to cough or sneeze, you will prevent the spread of the droplet that then can transmit the COVID-19. Cleaning and disinfecting surfaces, doorknobs, handles, light switches, tabletops, chairs, arms of chairs, all those kinds of things regularly can help prevent the spread of disease. This is highly contagious, we're finding, and we are seeing cases of community transmission now in our local areas in all 3 of our states. That means that they're not really sure whether the person came into contact with someone known to have coronavirus or whether or not the person had been in an area that was known to have coronavirus, the COVID-19. So community transmission becomes a little more concerning because we can't track and know exactly who to isolate at that point. So we need to use utmost caution and keep our 6-foot distance and our social distancing to care for ourselves, prepare our homes with food, supplies, medications that we might need for up to a couple of weeks, just as we would in a hurricane or another kind of disaster, snowstorm, and then perhaps check on our neighbors and see if they are able to be prepared or if they need any assistance that way, and keep in touch with our congregation members as well to make sure that we're all able to stay safe and well.
Thank you, Debbie. This past week, we received a lot of advice from our state officials, and I've asked Reverend Marilyn Kendricks if she would share some of that with us.
Sure, thank you. And good afternoon to all, and blessings in this challenging time. We have some information that's come from the state of Massachusetts around the policies that they've instituted for state employees, and we think it's a good list, and so we have embraced them as our own. So we're suggesting that everyone limit your international and domestic travel. Limit domestic travel, completely curtail international travel. And if you have to travel internationally, then it's important that upon your return, you self-quarantine for 14 days. The conference also would suggest that you not hold any large events. The definition of large changes depending on who you're talking to. I think we're thinking about 100 people or more is large, but you'll be interested to know that we have canceled all of the conference events that were scheduled for the next 30 days. And after that period of time, we will reassess what we're going to do going forward. We're also canceling all in-person meetings and programs for the next few days. We're instead using Zoom meetings, social media to continue to stay in touch with one another. I assume by now that you may have heard that the NYE 2020 has been postponed to some future date. And so the national UCC is also on the same page with the rest of us. Some very small group meetings, 3 to 12 people, committees or boards can still meet as long as you can maintain that social distance, but it is preferable to hold these meetings virtually, if at all possible. We're asking that our employees of the conference not attend any conferences or seminars or workshops, particularly if it's a wide geographical area. We're suggesting that anyone hosting those kinds of things look to holding them virtually instead. All of our facilities, we have some various locations of the Southern New England Conference, and all are being sanitized regularly in high-touch areas, doorknobs, light switches, those kinds of things, your own desk, just like Debbie said. And to that end, we have decided to close the conference offices for 1 week, or did we say 2 weeks? 1 week, okay. I don't know why I was thinking 2. 1 week, and we will reassess at the end of the week whether we will go forward with that. And that includes both the Hartford and the Framingham office locations. All of our staff will be able to work from home and meet virtually via Zoom. It also includes our remote locations that we have in the conference. If you do find out that you've been in a location where someone has been diagnosed as having been exposed to the coronavirus, we suggest that you follow quarantine guidelines of 14 days of self-quarantine. Right now, we know it's hard to get tested, so we can just assume that self-quarantining is the best thing to do. I think I've covered most of this stuff that the state and the government has shared with us so far. So I'm going to turn it back to Don.
Great. And many of you have come on this video because you have particular questions around the implications of all of this for your local churches. We've shared with you some of the state guidelines and the guidelines we're implementing here in the conference. Well, I'm going to turn it over to Ken Salati and invite him to share with you some thinking that we want to offer to you about how your church can be more responsive in this time.
Thanks, Don. I want to begin with a reading from Romans 15, chapter 15, verses 1 and 2. Those of us who are strong and able in the faith need to step in and lend a hand to those who falter, and not just do what is most convenient for us. Strength is for service, not status. Each one of us needs to look after the good of the people around us, asking ourselves, how can I help? That's from the Message translation of Scripture from Romans 15. So we would encourage you to look at our website. There are good checklists there for local churches, and you certainly have seen many of those checklists, I'm sure yourself, as you've been paying attention to the COVID-19 virus. We, as your Bridge Conference ministers, recommend that churches suspend in-person worship for the next 2 Sundays at least. I want to say that again. We, as your Bridge Conference ministers, recommend that churches suspend in-person worship for the next 2 Sundays. And part of the reason for that is, as many of you've seen, the way in which the virus escalates. And many of our churches have already made the decision not to hold worship on Sunday. We're seeing that come through. And so it is our, again, recommendation that churches not meet for worship on the next 2 Sundays, and then to evaluate that after the period of time. We'd like you to also think about monitoring your local health department, because a lot of this is a local decision, and churches are going to make the decisions that you all will make the best decisions for your local community, we know, and that you consult with area governmental officials. And we note again that many congregations are already making this decision, and we would support that. There are resources for you to consider and to think about. And one of those resources is, how could we do something online? Those of you who are joining us online already know how to get online and have an opportunity to connect with people. We are hoping to provide some of those worship resources. A small team will be meeting tomorrow, and we'll be talking about content for local churches that may not have the capacity to provide worship resources for their local congregation. And we hope to provide some of those, some content for local churches to take advantage of during this period of time. The other thing that we encourage churches to think about, if you do in fact go with our recommendation, and that is to think about your most vulnerable in your community, those who may be shut in or who may not be able to have access to technology. There is something called the telephone, and you can pick up the phone and call folks. I know that's an old-fashioned way, but we recommend that local church leaders think about the most vulnerable among you and ways in which you can reach out without physically being present to people at risk, but being able to make your love and compassion known to those folks. Letters, phone calls are ways to do that. Churches are also, I'm sure, worried and concerned about income during this time frame. And if you have not yet done electronic giving within your church, we would recommend that you look into that and find ways for your churches to receive income that way. If you are going to be streaming, and I know that lots of our churches are streaming their services already, they've been using the Facebook Live portal to do that. If you're going to do that, we would recommend that you be aware of copyright restrictions for live streaming and recording of worship, including music licenses. The CCLI 1 license may apply only to copies of music that are used in-house. So that if you are going to use music and use that in a live stream way, we would recommend that the church get the license that allows you to use it for streaming. And we've just researched that literally before we came on just now. And Tiffany Vale has assured us that that is an affordable thing, that for most churches, it'll be $100 to add the streaming component to this. The other thing, if you're going to do online broadcasting, that you need to be aware of our safe church policies around video broadcasts of people without their permission, especially if children are going to be involved in some kind of streaming way. We also want to remind you to be aware that people with disabilities, particularly hearing challenges, may not be able to access an online service the way that those of us who are able to hear the service can. can do that. So if you can look into, we're beginning to look into and trying to find out ways to address that, which could include mailing out the printed materials that you're using in your online streaming, or exploring closed captioning as a possibility. The other thing that you want to think about is Holy Week and Easter. It's unclear where we'll be at that point in time, but I think you'll want to be making plans ahead for that. If you decide that you have a small group of people that join us, and many of our congregations may have congregations where a small number, 20 to 30 to 40 are worshiping together, and you decide that you do in fact want to go ahead with in-person worship, there are practices that you probably have seen that are up on our website, but things like not passing the offering plate at communion, practicing safe practices around distributing communion. The Episcopal Church recommends not using a common cup and only distributing bread individually. And to write up those practices and have those available in your worship bulletin so that people are aware of that. We also want to encourage you to use social media, but also to use virtual ways to meet and to gather for your meetings, your board meetings, your committee meetings, sharing of information, and asking the question again about the most vulnerable among you. Pastors visit in hospitals and nursing homes. Before you go to make those visits, we are inviting you to make sure that visits are allowed in those institutions, and follow the practices that those institutions might give you around how to care for those who are in need and the most vulnerable among us during this time period. And also the question of what happens if our pastor gets sick? What plan is in place among leaders of the church if your pastor is unable to provide pastoral care in whatever means that has been determined? What is the plan in place for that to happen? Be connected to your local community emergency response. We represent many different local communities, and there are really good resources out there that can help you and your facilities to have a role to play if this becomes something that becomes more widespread in your community. We would also like to have you think about the economically insecure individuals who may not have sick time off, and what provisions you might be able to make as a congregation to provide support if there is a widespread quarantining of folks, how you can reach out and help folks in that regard. We'd love to know what you're thinking. We'd love to know what ideas you're playing with, thinking about, putting into place. We want to be connecting with you along the way. Social media obviously is one way to do that. We have a robust Facebook page that many of you are viewing this conversation on right now. Our email is available 24 hours a day. We may not check it 24 hours a day to practice good self-care, but there are ways for you to connect with us and ask your questions and share your concerns and ideas. Let's build this community of response together, because we have the capacity to do the work together by virtue of some of the amazing technology that is now at our hands, and we invite you to do that. We also invite you to hold one another in prayer. That the particular emphasis on lifting each other up in prayer is a really important discipline that we as people of faith bring to the pandemic at this moment, that we believe that God is our refuge and strength and a very present help in trouble. And this is one of those times where we are reminded of the body of Christ and the ways in which we as disciples of Christ, attempting to live the love and justice of Jesus, are called to do some really particular things in this moment in time. So I'm going to stop there, Don, and see. All right, I'll turn it over to you.
And I'm turning it over to Tiffany Vale. Again, I want to thank Tiffany for helping to make this video possible today. She has been monitoring questions on the side and will pass those along to us so that we can respond to any questions that may have not yet been answered.
Don, I would like to comment. Fred Mead put a comment up that self-care is very important and we should take advantage of the great weather and take a walk outside. And I would like to echo that and offer that we can use this time when perhaps our fellow congregants cannot gather together to encourage other spiritual disciplines that maybe we have not focused on. We might have extra time in our lives with a lot of events being canceled. We can provide online resources for meditation, encouraging Lectio Divina, breathing patterns, relaxation. We could do a virtual book group or a virtual Bible study to stay connected and rooted in our faith, and to help us feel the grace of God and feel that God will sustain us together, rather than panicking and focusing on the anxiety and chaos that's all around us.
In times of disaster, it is a natural response for many people to either try to step into heroic phase or to withdraw into paralysis. So I think that the importance of finding that place to keep ourselves individually grounded and to stay connected in support with each other. Thank you, Debbie, for that.
Thank you.
There are a couple of questions from people about other uses of the building, of their buildings. One about churches that feed meals regularly to the homeless and what they should be doing. And another question about, scout meetings, support group meetings that go on in the churches, and what they should be doing in regards to those.
In terms of meals programs, I would advise people to be in touch with your local health agent and find out what guidance and restrictions they may be placing around that for you. It creates a particularly vulnerable issue when you have open meals within your building. Debbie, you may have additional insight on that as well. In terms of renters, I would, as we are doing with you, we're sharing with you some of the guidelines that we are placing on the conference and encouraging you to consider the same. I would have those same conversations with your ongoing groups in your building. I also would refer you to the pandemic checklist on our website that gives you some further guidance for conversations with renters and building users. Debbie, do you have any ideas?
In regard to the meal programs, many of the meal sites that are in my area are the Shoreline Soup Kitchen and Pantries that are held at various congregations. And I know that that organization is working very closely with the health department for recommendations. In terms of serving food, they want to make sure that there is someone using all the appropriate precautions actually serving the food so that all of those gathered are not touching the serving utensils. Also really good sanitation practices in the area. They're not wanting to shut those down yet, at least what I heard of within the last couple of days. That may change, but as you said, these are our most vulnerable people and they need the support of these food pantries to sustain week to week. So they are carefully looking at that, and I would encourage, the local health authorities' advice. So,
Tiffany, what else do you have for us?
Sorry. You're Tiffany now.
Tiffany is here. Hooray!
There was just one question from Maine where they have not had cases yet as to how much time elapsed between when there were cases confirmed in our area and when you decided to make this recommendation to suspend worship.
So we just made the decision to suspend worship about a half an hour ago. So it's literally just a decision that the 3 Bridge Conference ministers in consultation with Debbie have made. So I hope that answers the question. The question about outside user groups, I think the leaders of the church need to decide if we are going to close our building, then communicating to outside user groups is really an important part of that, obviously. So if you have contact with outside user groups, I would let them know that we've made this decision to close our building during this time out of interests of safety and concern for our community, and to let them know. Questions about things like funeral services, memorial services, again, I think that's the common sense approach of being able to consult with the family, finding ways to offer pastoral care without actually doing that in person. If there are people at risk, you've got to consider that in those circumstances. And that if you are moving ahead with gatherings, that you practice the best health practices that we've already spoken of, and which are well resourced, I think, in the society today.
Can I add regarding the question from Maine, which also pertains to, for all of us, for Sunday morning, a week and a half ago, we had maybe less than a dozen cases or presumptive cases in Massachusetts. Last Sunday, we were still thinking of holding Super Saturday with a lot of provisos. Even at that point, we had maybe 3 or 4 dozen. It was doubling every day. On Monday, the superintendent asked us to cancel Super Saturday. On Tuesday, we had a state of emergency declared by the governor. So within 48 hours, we would have been forced to close it anyways. The shift happens just that quickly with the pandemic. So what we are saying today, what we are thinking today in terms of this coming Sunday could change dramatically in the next 2 or 3 days as more information comes to us from state and federal officials. Please stay informed and use that information to safeguard yourself, your congregation, and your community.
Don, there's a question about best practices for church potlucks. Are those the same as for soup kitchens? And, you know, this is just a personal opinion of mine, but if you're having a potluck to gather and you're suspending worship, I would suspend the potluck as well. We have to really look at those of us who are gathering may become exposed, may have been exposed and not know it yet. And then if we have someone who becomes ill at the gathering, what are we going to do with that person? We need to isolate. We need to get the public health department involved. We would need to be isolating greater numbers of people. And I think prudence is just to avoid having to start that whole domino effect of response that would be required to protect ourselves and protect our people who are vulnerable to really serious illness with this. When we're talking about soup kitchens, I mean, those people are vulnerable in a whole nother way. So there's another level of thought process there.
Very well said. Thank you, Deborah.
And I did answer that question, but not everyone may have seen that about the soup kitchens. It may be, and I've seen this, I actually read this morning from a church that does have a soup kitchen that has made the decision to offer meals, but to do that outside and to do that with takeaway meals rather than having people come into the building and sitting down with risk of exposure that way. So that's one, I think, solution to that. Questions raised about daycares. We do have daycares and nursery schools in our buildings. I think that's a conversation that you should have with the directors of your of those facilities, of those daycare and nursery places. Speaking with them, talking with health officials, getting good on the ground local recommendations around that. I think if you're going to close your building down, you obviously, again, want to communicate that early to user groups in the church building.
There is a question from one of our pastors. She says, with the understanding that this is a changing landscape on a daily, hourly basis, Is there a plan for updates like this next week and in the weeks to come?
What a great question. Yes, we talked again about that earlier, that this is this is number one of a series of what we hope we'll do on a regular basis because of that very reason. It's such a rapid changing landscape, as you've said, that we agreed that we will host these kinds of conversations certainly on a weekly basis going forward until we're through this period.
I would also direct people to the coronavirus webpage on our website. We are literally updating that almost every 5 or 10 minutes with new links and information that are coming into us. And many of the links themselves take you someplace that is being constantly updated. So in between these Zoom meetings, these gatherings, do keep an eye on that website and our social media page and our emails. We'll be continuing to send information out as often as we can.
Tiffany, are there any other last questions that have not yet been asked that we want to attend to?
Not that I see.
Okay.
Give you a minute. I was going to penultimately close with a pitch to go view our website, but I just did that. So if there are no further questions, Kent, do you want to bring us home?
I would like to offer a prayer, if I might. And the prayer was written by the Reverend Dr. Hannah Adams Ingram. And she wrote this prayer 2 days ago, which seems like a long time ago for some of us. And she titled this prayer, "Oh God, I'm Spinning Out." And Dr. Adams is the chaplain at Franklin College in Franklin, Indiana, and has given us permission to share it. So I'd like us to close this particular version of Facebook Live today with this prayer. Let us pray. There is so much I do not know. There is so much I cannot see. There is so much I cannot control. In the moments I feel powerless, I will take a deep breath, trusting that I am tasked only with doing my part, not the whole. In the moments I feel unsure, I will take a deep breath, trusting that I am not alone, and that together our wisdom will be richer. In the moments I feel anxious, I will take a deep breath, trusting that there is no depth I can fall out of reach of the Spirit that holds me close. What I do know is that my life and love and worth extend far beyond my work. What I can see is that spring follows every winter and new life pokes out from cold ground. What I can control is my breath and the love I inject into a world so clearly lacking it. And now these three remain: faith, hope, and love. But the greatest of these is love. Amen and amen.